So guys, now the question arises, how to evaluate a patient who is suffering from Lyme disease? Now, it's important to remember that in the endemic areas where Lyme disease is prevalent, if you see there are features of the classic rash and there is recent tick exposure, treatment can be started without waiting for blood tests. However, in the vast majority of patients, the symptoms can be somewhat vague and testing is kind of needed. And sometimes people may not even recall a tick bite or that they developed a rash. Now, serological testing is insensitive during the first few weeks of the infection, and patients presenting with erythema migrans rash and history of one residing or number two traveling to an endemic region may be treated based on clinical findings. But all this depends upon the physician's expertise regarding the matter and how confident the patient and the physician is. Now, the good thing is that in the later stages of the disease, serological testing can be easily used, and we usually do a two-step approach to diagnose Lyme disease. Now, the first step is to perform a quantitative screening test for serum antibodies to Borrelia Burgdorferi using a sensitive enzyme immunoassay, or you can even use an immunofluorescent antibody assay. Now, a Western blot should follow specimens with positive or equifocal results. A high yield point is that serological diagnosis is sensitive, even greater than 80% for patients presenting with neurological or cardiac manifestations. Now, some important points to remember is that sequential use of serological testing is not recommended in the acute state because antibody titers often remain elevated for a long time. Testing the tick is not recommended either, and biopsy of the skin is rarely done nowadays. Now, you may also do some basic lab work and it may reveal an elevated ESR. You can find leukopenia, that is low WBC count. You can find thrombocytopenia, which is low platelet count. Joint aspiration is only recommended if one suspects septic arthritis. Now, coming to the cardiac part of this disease, if you are suspecting an AV block, the first thing which you should do is an ECG. If you see a patient suffering from CNS symptoms, brain imaging can be done, and it may show abnormality in about 20% of the patients. Most common are punctate lesions of the periventricular white matter, but again, these are not very high yield things to remember, so I won't emphasize on these things. And last thing to mention is that Borrelia species are really hard to culture, and thus they are not routinely done. So again, giving you a summary of this section. If a patient comes to you with Lyme disease and he is suffering from the characteristic rash, and he also tells you that he has been to an area where Lyme disease is endemic, you can start treatment. Now, if the patient comes to you after the acute stage has passed, then you can use serological testing to diagnose Lyme disease. And other than that, if you see like any other symptoms, like if you see heart symptoms or CNS symptoms, you can do the respective test for that as well. So bottom line, if you see a patient suffering from Lyme disease with the characteristic rash and he has been to the endemic area, treat the patient. So now the question arises, how to treat the patient? Now, it's important to remember specific treatment is dependent upon the age of the patient and stage of the disease. The age which I want you to remember is 8 years of age. If the person is 8 years or above, treatment is different. If the person is 8 years or younger, treatment is different. For patients older than 8 years of age with early localized disease, doxycycline is recommended for 10 days. Patients under the age of 8 should not receive doxycycline. They should be given amoxicillin or ceftriaxone. Why is the thing which you might be asking? Why should a patient under 8 years of age not be given doxycycline? Well, the answer to that question is that doxycycline causes tooth staining in younger children, so it's better to avoid it. Now, longer courses and parenteral antibiotics may be required for more severe manifestations such as arthritis, AV block, carditis, meningitis, and encephalitis. So guys, just to make it a bit simple for you, remember that doxycycline is used in most patients except children and pregnant women. In children, amoxicillin remains the drug of choice. Pregnant women show a good response to ceftriaxone. Now, there are other symptoms which have to be managed, like for example, patients with Lyme carditis should be admitted and monitored until the ECG features of a heart block subside. Lyme arthritis usually resolves in 6 to 8 weeks. CNS Lyme disease responds well to antibiotics. An important point to remember is that clinicians should monitor patients for the Jarisch-Herxheimer reaction when starting therapy for Lyme disease. Now, we have already talked what Jarisch-Herxheimer reaction is in a previous lecture on syphilis, and you might check that out as well. One last point to remember is that the ocular feature of Lyme disease responds to topical steroids and IV ceftriaxone or penicillin. So basically, the theme of the treatment of Lyme disease is that you need to remember 2 antibiotics, doxycycline, which is given in most patients, and if the patient is not eligible for doxycycline, you can use penicillin or cephalosporins if need be. So this brings us to an end to our section on the treatment part of Lyme disease, and it also ends the whole lecture as well. If you ask me at the end of the lecture what the takeaway points are, I'll probably say just remember where Lyme disease is seen, that is the different parts of the US where it is endemic, number 1. Number 2, do remember the different clinical features of Lyme disease, and there are many. So you need to be very clear about what you're going to see in the different stages of Lyme disease. Number 3, you need to know what tests you have to perform if the need arises and when to just treat right away. And number 4, you need to know what drugs you need to use when treating Lyme disease, when to give doxycycline, when not to give doxycycline. That is important. So I think these are the high yield points as well. I think these are the things which will be tested on your exams about Lyme disease. So do well to remember them. And I hope the things which I tried to deliver across to you guys, I was successful in doing that. Stay tuned to sqadia.com to learn more. Thank you.